Hope you're all okay. I'm delighted to invite you to this part of our webinar series. My name's Audrey Bouazizi and I'm the Head of Service at Adopt London South, and I'll be working with a few of my colleagues just to make sure that we give you a really good experience and understanding of our Safer Spaces, which is our Black Adoption Project webinar. Do forgive me, unfortunately, I'm unable to see anybody at the moment, so I won't see if there are any questions, but if you do have any questions, please pop them in the chat and we'll be able to help and support you through that. So just to give some introductions, this is a series and it's a webinar that's focused on the Safer Spaces evaluation findings of the Black Adoption Project. We've got more webinars that are coming that are focused on different areas as well. And we hope that, you can find out more about previous webinars by visiting our webpage, which is adoptlondon.org.uk. We can put that webpage in the chat so that you can get access to that. So we just want to give you those brief introductions to kind of what we're here and what we're about. I've introduced myself. I'm Audrey Bouazizi. We have a number of speakers, so I'm going to hand over to my colleagues to introduce themselves. Chloe, may I start with you?
Hi everyone, I'm Chloe Fasan and I'm the Business and Performance Manager at Adopt London West.
Thank you, Chloe. And Yaa?
Greetings everyone, I am Yaa Yeboah-Newton. I'm a qualified integrative counsellor and therapist and a trainee psychotherapist.
Fantastic. Thank you. Lovely. And Audrey?
Thank you very much, Audrey. I am Asra Maiman, and I am a qualitative research and evaluation professional working in the social and international development sector. And I worked on this evaluation of the Safer Spaces session as an associate with the Laurel Brown Training and Consultancy. Thank you.
Fantastic. Thank you. So we've got a range of people that have been involved in this project. We'll have involvement and have some input into this project and thinking about what we've learned from it. And we want to take this time just to learn about the Safer Spaces. And so we'll go through the evaluation process. We'll be doing that through this slide deck. So if you do have any questions that come up at any point, please pop them in the chat and we'll try and get to as many as we can at the end of the conversation. If we don't get a chance to reach all the questions, please still put them in the chat anyway, and we'll do what we can to provide responses to you after the session as well. So if there's anything that you want to find out about, that will be a really helpful way to go. So I just want to set a little bit of context, really. And I think just so that you understand why we're doing the Black Adoption Project, we're all really clear that disparities for Black children have been a stuck problem in the UK for longer than I care to remember. And this is just the reason why we're doing the whole of the Black Adoption Project, not just the Safer Spaces. So it's just to understand that the wider context there. So we know that we've still got the understanding of racial issues remains limited, and we're fully aware of that, and that there's leadership commitment to tackling racism is varied. So we don't get a same approach or a decent approach everywhere that we go. Some places are doing things very well, some places not so well. So we just want to kind of hold on to what some of those challenges are. There's racial oppression and inequalities that persist across the system. So we know that all of those things are factors that have led us to thinking about why we're doing this project. As a collective of 24 local regionalised adoption agencies, London has actually got a unique opportunity and a duty, we feel, to start to address this issue. We work together as four Adopt London regionalised adoption agencies. So that's north, south, east and west, but we've come together and we cover 24 boroughs between us. So given that magnitude and that scope and scale, we thought it was a good opportunity for us to start to look at this issue. And it gave us the first opportunity to be able to do that rather than looking at individual local authorities trying to address this problem in isolation. So the Black Adoption Project is, it's a long-term project. We're not thinking that there's going to be any results immediately and overnight, but we're looking at making systemic change to think about how we can invite the right people into the conversations, make sure that they're taking the lead in conversations where they need to, to implement real, lasting, sustained change. And our webinars really, the focus of those is about sharing our progress and sharing our learning. And that's part of the commitment of the Black Adoption Project, to sharing learning so that other people can grow. And in this instance today, as you know, we're focusing on the safer spaces. So we're just going to take a moment to look at the pilot now. So we've been running the Black Adoption Project pilot, and that has been the Safer Spaces pilot has meant that we've tried to create space where staff could attend, understanding what some of those earlier pressures were. So staff were able to attend those safer spaces and think about their own kind of learning, safety and growth within their own organisations. And one of the things that we wanted to think about was how regional adoption agencies are able to kind of create those opportunities for Black staff to have greater sense of safety within their spaces of work. So in doing that, we just had to think about, you know, what are the approaches that we're going to take, and we wanted to ask a few questions, a few key research questions around the actual Safer Spaces project. And to do that, we had an independent facilitator and evaluator, who's Audrey, who's just introduced herself, who supported us to design and evaluate the pilot of the Safer Spaces sessions. So these were the questions that we looked at there. And we wanted to think about how the actual attendance at the Safer Spaces sessions was going to improve people's overall experience within the workplace, knowing that in adoption, it's dominated primarily by white staff, and that changes as well as we got the leadership structure as well. So there were the questions that we wanted to kind of focus on. How can people enhance their sense of safety? What's the impact of the participation in safer spaces? And we're looking at that in terms of their professional skills and people's confidence, and any unintended consequences or outcomes for Black staff as well. We wanted to think about as well how the services could effectively establish good, trusted communication channels as well, so that where it's appropriate to do so, our Black staff are able to feed back on organisational matters that are actually impacting on their day-to-day work. And we wanted to think about what the barriers were and what the opportunities were in implementing safer spaces for Black staff within the RAAs. So the safer spaces, just to help you understand how we've evolved into that space, it was developed as a response to the systemic challenges that were faced by Black staff, and that was magnified after the horrific murder of George Floyd. And so that was kind of where this iteration of this piece of work began. And we wanted to think about how staff were able to provide to find a space to share their experiences, and think about how they're able to receive support. So it was it's just finding that safe space where people could sit down, have those discussions, you know, and think about the impact on the workplace challenges as well. So in doing that, we looked at a safer spaces evidence review as well. So we're thinking about who is it going to be available to. We looked at a review, and we thought about understanding better about what the situation was for our Black staff, making sure that they've got their space to talk things about, and thinking about how we're aligning that with our broader mission of creating equitable and anti-racist adoption systems as well. So part of that system, obviously the workforce is a massive part of that system, and we had to make sure that we focused in that specific area. So we know the safer spaces have have emerged thinking about critical interventions in those predominantly white institutions. So we wanted to think about, well, what is going to be the impact for our staff here, and how are we going to make sure that we are attending to their psychological safety in those spaces. I've got to just highlight that thinking this through, while these groups are serving as a really essential platform for discussing racial inequities and processing the workplace discrimination, we know that sometimes there are some challenges that will arise that actually stop for us from being able to focus on the effectiveness of the group. So there are barriers that are in place that we want to make sure that we're trying to attend to, and make sure and give a much better experience and account for our Black staff's lived experience. We recognise that there's a good evidence base that tells us about the groups fostering a good sense of belonging. and collective empowerment by validating the lived experiences. So we know that our staff have talked about and have understood that the level of microaggressions that are faced, and the systemic exclusion that happens just by virtue of how our structures are built. But we've also recognised as well that there can be a challenge in these spaces becoming a bit of a symbolic gesture. And so it's something that we just do to appease. That's certainly not the intention of this safer spaces, but we want to think about providing that psychological relief in a much more appropriate way. And so there's a key phrase there that says that safe should not and cannot be the goal for such spaces, and that's why we talk about safer spaces. So a lot of the safer spaces have been rooted um, in research, obviously along racial lines, but also in the queer movement as well. So we've had a lot of understanding about what those minoritized groups are thinking about. So we've taken our learning from those pieces of research, and then we've focused in that area. So, consideration of our previous spaces. So over time, we have focused very much on learning through the process. So, and that's very much indicative of the actual project's desire and ability to learn and to adapt approach. So I think as the project grows, we're always going back, evaluating, looking at learning and strengthening and trying to improve. So the third phase of the pilot has been built on the successes and lessons learned from the previous iterations of 2022 and 2023. The feedback from 2022, as you can see, it was largely positive, and most people were saying that the sessions have been really relevant, not only to their professional lives, but also to their personal lives. So they've taken some good insights from that, which has been really helpful. But one of the things that did come up as a bit of a barrier was the impact of the work commitments and the lack of awareness, and how that hindered participation in previous years. So that's one of the things that had come up as a bit of a challenge. And another key consideration from those previous phases was thinking about how we make sure that the sessions remain inclusive and accessible to everybody that wishes to join. So the criteria for this, actually, in terms of trying to not inhibit conversations, it actually excluded management. So this was it's primarily for staff, but that was either staff working within the social workspace, or the administrative, the business support space, open to male and female. So we want to make sure that it was open and available to everybody in that time. And I kind of just want to really sit back and think about what some of the Black Adoption Project principles are. So they're there on the screen, and I won't read them all, but there are two really that we really want to focus on in terms, and I think they're all relevant to this particular pilot, but actually there are two that we want to focus on. And the first one is that how we think about using data to guide us. So we have spent and invested a lot of time at gathering information and insights into what isn't working, and what the questions do or don't need to answer. So throughout that time, we've had to think about making the changes, and then that naturally flows on to learning and adapting as we go. So there are complexities in and amongst this. We're trying things out, we're learning from them, we're being really transparent in our communications and understanding what that is in terms of the whole project team sitting behind this. And we're also open to the new ideas and to the different approaches that people may be recognising. So although the safe space is confidential, we don't know within our services who attends. We know who it's open to and who it's eligible to. We know numbers of people attending, but we don't go into granular detail. So that actually kind of promotes that sense of psychological safety, because we have an external facilitator who facilitates the group. So here we are with the pilot design and just thinking about what that looks like. So the current design focuses on monthly sessions, and they're run for an hour and a half once a month. And the current time that we're delivering those is Thursday afternoons, and they've been running from July 2024, and then this particular phase has concluded in December 2024. So the sessions are online and they're via Zoom, but we do have to have registration through an external partner system, and that's to maintain the confidentiality. And it's been led by an external facilitator from Laurel Brown Training and Consultancy. which is Victoria and Zerube. So she is a trainee psychotherapist, and she's got lots of experience and expertise in the area of kind of racial equity, youth and community work, and children's social care. So she's brought a lot of value to the actual project itself, and to kind of thinking about being that external voice outside of Adopt London, which has kind of worked to create a sense of safety for the participants. And there's also been a real trauma sensitive approach as well to addressing some of the complex issues that have arisen. And if we think about why the Safer Spaces have started, which was in response to George Floyd's murder, and thinking about how we can support our staff, we understand inherently that there will be trauma involved in the birth of the pilot. And then we need to think about how we're keeping people safe psychologically in that space. And we've got to acknowledge the impact of the individual trauma and the racial trauma that sits alongside that. So we're moving on to the evaluation, and I think that's over to you, Azra.
Brilliant. Thanks very much, Audrey, for setting up the context of this piece. So primarily with regards to the methodology that we adopted for this evaluation, we ensured that this was rooted in a mixed methods approach, which we felt was essential to capture really the depth and complexity of the pilot. And also, given the initiative sought to provide the Black staff with a secure environment to share workplace experiences and foster professional confidence, we believe that was crucial, in fact, to explore both the quantitative and qualitative dimensions of the impact that the project might have contributed to. So overall, our evaluation used a mixed methods approach, employing methods like document analysis, participant survey, heads of service survey, and then also engaging in conversations with the participants themselves who took part in one or more of the sessions, and then of course also engaging with the facilitator themselves. Generally, it was to ensure, again, to capture the initiative's depth and to be able to capture both quantitative and qualitative insights. Moving on, please. So with regards to the actual findings that came about from this analysis, it could be said that the Safer Spaces sessions were generally well received by the participants in such a way that the sessions in fact offered a structured yet flexible format that encouraged open dialogue. The sessions, which were held mostly virtually, followed a consistent structure, like Audrey has briefly mentioned already. So opening welcome, facilitated discussions, and also a closing guided meditation. So generally, the respondents also suggested that they felt comfortable primarily because, again, of the facilitator's crucial role in maintaining an inclusive, respectful, and supportive atmosphere where the participants could share their thoughts and experiences. And they really felt heard during these sessions as well. One of the things that also came about was an acknowledgement of how the facilitator employed various strategies, including reinforcing confidentiality, summarizing key points to validate contributions, and also using open-ended questions to encourage deeper reflection, all of which contributed to the sessions being safe for the participants. That said, a few challenges did emerge in terms of session implementation. For example, there were logistical barriers, particularly with regards to the actual modality of the sessions. Using the right virtual platforms is certainly a consideration to ensure that the sessions are efficient as well. And then it was also shared that the once a month session frequency could potentially be insufficient, especially when there are crucial topics to be discussed. So this was particularly relevant when there were heightened racial tensions in the country, and that really went about to participants highlighting that there perhaps need to be more sessions. So with regards to the actual perception of safety, one of the significant outcomes of the Safer Spaces sessions was the sense of psychological safety that it provided within the sessions. And then the participants consistently throughout the evaluation process described the space to be confidential, non-judgmental, and emotionally supportive. The facilitator was able to play an essential role in creating that space, an environment where attendees felt comfortable sharing their experiences, which ultimately served as a key factor in fostering trust and engagement as well. Many participants also noted that they, quote unquote, needed the space and very much looked forward to attending, in a way reinforcing the session's value as a vital support mechanism. So that said, a critical gap still remains between the perceived safety of these sessions and within these sessions, and of course, the broader workplace environment. Several participants highlighted that while there was a lot of emotional relief provided by the sessions, this needs to be very much in line with major improvements within the overall workplace culture. That said, we did see in our evaluation massive support from the heads of service on continuing such initiatives to ensure that there is that alignment as well. Moving on to professional skills and confidence, the impact on professional skills and confidence. So generally, the sessions had a positive impact on participants' confidence and professional skills, again, providing them a platform to voice their concerns, particularly in the areas of self-advocacy, communication, and conflict resolution. We have on the screen some of the direct quotes that we heard from the participants. The sessions also served as a collaborative problem-solving space in some instances where participants actually discuss workplace challenges and even strategized solutions. And then again, I think there were also some limitations that were highlighted in translating these gains into tangible workplace improvements. So participants clearly admitted that they had gained confidence. However, this confidence did not always extend to their day-to-day work environment. When it comes to barriers to participation that were identified, so certainly there were workload pressures, scheduling conflicts, and a lack of confidential spaces within the workplace environment that hindered their participation in some ways. Some staff struggled to prioritize their attendance due to competing work demands, despite having that support from the management. Others had difficulty finding private spaces for virtual participation. So these were some of the barriers that came about. Despite these challenges, the initiative presents several opportunities for growth as well. If we could move on the next slide, please. So we hear from the heads of service, particularly an acknowledgement of the importance of these sessions. A head of service explicitly mentioning that this current group must continue to exist as it is. It is because the initiative provides essential support and should certainly be maintained. Additionally, the sessions have demonstrated significant potential for professional development, confidence building, and also emotional well-being. So these must be expanded and refined to maximize their long-term impact. There's also an opportunity to bring in external experts, but also building on staff strengths to highlight and leverage the unique expertise that the Black staff might have, but also focusing on their lived experiences in order to ultimately empower them to lead these sensitive discussions and also share strategies for success. And generally, I think one of the biggest finding that came about from this whole evaluation is making sure that these safer spaces sessions are very much embedded into organizational systems, given the fact that there's so much value in these, rather than them functioning in isolation, like Audrey initially mentioned about these falling into a risk of siloed interventions. These sessions should certainly be integrated into wider organizational equity strategies, ensuring that any insights that come about from these sessions can ultimately translate into policies and an improved workplace culture as well, ultimately tying back to the overall goal of the Black Adoption Project. So yeah, this is all the findings that came about.
Thank you, Ezra. That was really helpful summary of the findings from the current evaluation session. So now we need to think about what the next steps might look like. So in terms of our continuous learning, we really want to think about how we continue the regular sessions, but make sure that they're worthwhile and make sure that they're still of use to the staff that are making use of them. One of the things that we do realise is that we had quite low return rates for our evaluation. So our evaluation, whilst we undertook it and we did a very thorough job of it, what we didn't have was maybe the sufficiency of numbers in terms of feedback. So I don't know if that in and of itself is telling us something. But we do want to think about whether or not there's an opportunity to think about balancing online and in-person sessions, actually to address some of the challenges. And then we've got to really think about what are those barriers that people feel that they have, and what the actual the reality of some of those barriers are. Knowing that we're having these sessions on a monthly basis, I think we've got to, understand better how we can overcome some of the particular challenges. And certainly there's a massive commitment from the heads of service within Adopt London and also within the management teams to make sure that we're trying to do what we can to unpack some of those challenges. So for example, we wouldn't be booking meetings at specific times when we know that the Black Adoption Project Safer Spaces should be taking place. You wouldn't book one-on-one meetings or other meetings. There will be times when there are organisational clashes, and I think it's fair to say that some of those we can't mitigate against, and certainly within the business of what we're involved in, we wouldn't want to do anything that would cause delay for anybody, in a significant way, have a significant impact on some of what goes on for them. So we've got to think about how we address those barriers. But we also need to maintain flexibility as well for those smaller groups that are coming in, because it's in terms of the numbers of Black staff that we have across Adopt London that we hope will grow over time. We want to make sure that there's still flexibility for people to attend, and also keep the kind of focus on the wider systemic and the institutional change that this is bringing about. So it's just something that we need to take away really in terms of thinking about our learning. So just thinking about where we are now and what the current situation is, we're in a process of just reviewing the evaluation findings. So we've got to understand what that looks like and what the impact's going to be. And the ideal next step really will be about, and very much aligned with the Black Adoption Principles, about co-creating the next steps with staff. So rather than doing unto people, actually having that co-creation conversation to think about, well, how is this going to work? Because I think it's there are challenges in here that we need to tackle together organisationally, to think about how best we move things forward to make sure that, if there's a future iterations of the safer spaces, what they need to look like, what they need to be like, and how that can be managed and balanced alongside the day job and taking care of everything else. And of course, the other thing is sharing the learning. So we're here doing that just now in this webinar, thinking about how we share the learning from the experience, so that if anybody's thinking about implementing safer spaces, there's a lot of learning from our own experience that can be brought into any of those future plans. So there's just a couple of quotes there that I'll leave you to reflect on for a moment. And I think just in this space as well, I just want to while you're thinking about those quotes, really want to talk about the challenge of how we maintain real fidelity to our project, maintain real fidelity to the pilot, in terms of, we have talked about the confidential nature of the pilot. And I think one of those things that can kind of be a bit of a barrier and a breach is how information is shared back to actually affect organisational change. So we're trying to find that sweet spot of balancing confidentiality, but having a good understanding of what's a real risk area for our Black staff, so that we can act on feedback accordingly. So that's something that certainly will come into the whole of the co-creation thing with the staff, I think, just to have a better understanding of how we can make real impact and positive time for our Black staff and a positive space for them. So I'm just going to leave that there for a moment. So please, if you haven't signed up to our mailing list and you feel that you want to know more about the project, please feel free to scan the QR code. So there's a feedback link in the chat. and we'd like you to kind of sign up to our newsletter to make sure you hear more about the Black Adoption Project as well. But I think we've got a few project questions that we need to go back to. So bear with me just a moment while I end in the show, if you bear with me for a minute, thank you. And we want to bring in the voices of other people who have been involved. Forgive me. Thank you. So we have a few questions for some of our colleagues. If you bear with me, I shall try to pull these up. So the first question, Azra, is to you. So are you able to tell us a bit more about why you felt the mixed methods was really important for this project, for this pilot?
Of course. As a social researcher, I always believe that there's often something that the quantitative methods alone cannot provide, and similarly, the qualitative methods cannot fill the gaps for. So similarly, when we developed an approach for this, our goal was to ensure that we take on board different methods. So we initially started with the document analysis and the literature review. So that especially ensured that we were able to situate the Safer Spaces session within the broader discussions on workplace equity and psychological safety, particularly in a white-dominated sector, for example. And so that basically gave us an understanding that while safe spaces can offer valuable support, their effectiveness can ultimately depend on the broader organizational commitment. So these issues did come about in the literature review and helped us inform the subsequent inquiry through the survey and the interviews as well. So give us a bit of a glimpse of what initially has worked in the sector and what doesn't, to ensure that the questions that we ask are the right ones and help us answer exactly what we need answered. And then when it comes to particularly adopting a qualitative approach, literally engaging with the participants directly, but also the facilitator, we believe that many intended outcomes, such as increased psychological safety and empowerment and self-advocacy, could in fact be deeply personal and not easily quantifiable even. So that's where the qualitative interviews really allowed participants to articulate their experiences well, of course, in full confidentiality. In ways that a quantitative survey, of course, cannot do alone. And then for us, the priority was also to ensure to very deeply understand the organizational barriers that are still limiting the participation of Black staff in these safer spaces sessions. So while, let's say, the data that we gathered through the surveys gave us an understanding of how many participants we did engage with through the surveys, how many of them highlighted logistical challenges such as attendance and session modality, for example. Qualitative insights in parallel helped shed light on the underlying workplace dynamics that might have influenced engagement, such as workload pressures, for example. So by integrating both of these methods, in addition to document analysis, the evaluation ultimately explored not just the outcomes and the impact of these safer spaces sessions, but also the broader factors that helped shape the need for such initiatives in the first place. And it helped us ensure that the evaluation was not just about assessing outcomes, but also understand broader workplace dynamics that can ultimately help us in implementing the recommendations that have come about from this evaluation.
Thank you. That was really helpful insight into kind of that why we've chosen the mixed methodology. And I think it has provided some really rich data. Thanks. And Chloe, next question's to you. So as a former participant of the Safer Spaces, what are your reflections on the value and impact of these spaces for Black staff? And also, secondly, do you think these initiatives need to be extended to non-social workers working in adoption?
Yeah, sure. So I found the Black Adoption Project safe space sessions to be really extremely valuable, especially during the lockdown where I felt a little bit isolated and sort of disconnected. from like social interactions and things like that. So a lot was going on in COVID, and I found it really helpful just to be a part of this sort of space where I could vent, and I could share my experiences in what I was facing in the work environment. Also listening to other people's experiences as well, it made me feel not so isolated and not so disconnected, to the point that I didn't feel like I was alone in what I was dealing with, which was a number of things, personal issues, work-related issues, but things that I felt that I couldn't open up to my colleagues in that work environment. I felt that I could do that in this safe space. Um, and I went to a number of sessions. So it did gradually build up where I felt, okay, the first session, let me feel it out a bit. Let's see who's there, who's attending, and see, you know, is this a space that I could actually really let loose here and then. And I soon, after a few sessions, I soon began to realize that I could do that. So I would be lying if I said that I didn't find these sessions therapeutic. So the fellow attendees, or my peers in the sessions, they were really supportive as well. So when I was opening up, um, even the facilitator was quite quiet actually. It almost was like peer led. So I felt really supported just knowing that people were in the same spaces as me, have faced the same situations that I probably have faced. And I didn't want the sessions to end because I knew once you hit the end, you're going back to that. So I just always, that was my motivation to sort of keep attending the sessions and everything like that. So I could honestly say that the safe space sessions are extremely helpful and impactful to me personally, and I will never forget what it did for me in those times back then. And then the second part of the question with should we encourage non social worker sort of employees to attend as well, Black staff to attend, sorry. And I would absolutely say that because I was business support. I still am business support, but at that time I was, you know, sort of business support as in a business support officer. Um, and I felt like, oh, this is just going to be a space for social workers and they're talking about their cases and things like that. But no, they really made it feel like I was valued and heard as well. And they were listening to me. And I just felt really appreciative that as a non-social worker, that I was still being listened to, because it wasn't about our titles. It was sort of our titles get left at the door almost, and it was just about real experiences, sharing that with one another, supporting one another, and especially as non-social working staff, you know, we're answering the phones, we're dealing with inquiries as well, we're on the front line, so we need to be in good spaces ourselves to be able to sort of relay that and empathize with people that are on the phone to us and everything like that. So yeah, I can't shout the praises enough for the Black Adoption Project and the safer spaces.
Thank you. I mean, that's really insightful and really heartfelt there, Chloe. And I think, you know, as a former participant, you've got a unique insight and a voice that you're able to bring to this webinar that, you know, it wouldn't be, would be hard pressed to kind of get from anywhere else at this point. And I think it's just understanding that we don't always know what's going on for people. But I really like what you said there about being able to shed titles and just come as you are and be your whole holistic, authentic self in that space. I really like the way that you've kind of have highlighted that, and it certainly gives us a lot of food for thought, and clearly a need for the space as well. And Yaa, the next question's to you. So as we know, one of the prominent findings relating to prominent findings from the actual evaluation report was in direct relation to the facilitator skill to create that safe space for our attendees and participants, you know, and for them to explore their vulnerabilities and to explore any sensitive issues that may have arisen. So I want to ask you, how does this compare to your experience of supporting Black staff in similar spaces? And what impact does you being a Black therapist have in that space?
Yeah, thank you. And I'm also quite filled with the richness of the project and also your testimony to the project, Chloe, being a participant. So I think it speaks to a lot of the experiences that a lot of my clients have had and some of the people that I've worked with. So for those who are here, I wasn't the facilitator on this particular project, so I can't take credit for the great work the facilitator did, but I have some experience in similar settings. And so some of the work that I've done, working in mainly in the arts sector, where they're thinking about kind of diversity and inclusion, and how that can be embodied as a part of their culture within organizations. And what has come up in those spaces, so I usually would be like an EAP therapist for some of them, so some of the one-to-one clients that they have as a part of their employee assistance program. And what the themes that were coming up for staff were that actually they didn't really have or feel like they could embody this change within their organization because it wasn't felt by the management and people in positions of power and leadership. And so I was invited in to come and work with members of leadership, and there were split groups, some mainly for global majority folks. It wasn't exclusively black members, but global majority folks, and then white members of leadership. And that was quite interesting because it was quite important for when we're thinking about how to create systems change and how we can change culture and create psychological safety within our staff that informs people, service users and people that are accessing our services, that actually we need to be thinking about the processes, our own individual processes around racism, how we engage with racism from an internalized oppressive perspective, but also as somebody who is oppressed. And so working with the black staff and the global majority staff was quite important that they saw someone that looked a bit like them, that could reflect some of their experience, where there would be an innate understanding around some of their experiences without having to over explain, and the importance of witnessing. And I think that's also what I was hearing from you, Chloe, when you were talking about your experience, that there was so much internalized shame, isolation in their experiences around navigating racism in the organization, their own experiences of the internalized oppressor showing up and how they would navigate, and also not feeling like they had spaces to really bring that. So being in space with other people who looked like them and having a therapist who also looked like them supported those experiences to be witnessed. And then also in addition to that, you've got the collective witnessing that's happening, so people are knowing that they're not alone. And then it also allows us to kind of really start dismantling some of the shame that's held in those spaces and thinking about what empowerment really looks like, what it means to really embody this change in our work. And a similar thing that was happening in the white space, which was interesting, but a very different lens. Obviously, I'm a black therapist. I don't pass for anything about being black. And so being in that space as a black woman, working with white members of leadership and thinking about what it means to have me in the space to hear their experiences, where the internalized oppressor shows up for them, what it means to really understand their white fragility, where some of these policy changes and culture change might feel like a tick box exercise if they haven't done the internalized processing of what it means to embody racism. And it was really powerful because, again, in each of those spaces, what we are doing is really thinking about how we dismantle shame in a real tangible way so we can be embodied in this change. So for me, it's really important that staff have access to therapists to help facilitate those spaces, to offer containment, because we're also thinking we're bringing our personal experiences into those spaces and how they intersect in a professional space, and also where they inform our practices as professionals. And so making sure that we feel contained, making sure that there is space enough to navigate a group process, but also thinking about what follow-up means, because it's very important that a lot of this work is really powerful. It's powerful work. It really impacts people's processes. But we don't want that to be something that ends in a 1 hour space that doesn't get touched on. We need to be thinking about the continuity of these spaces, and then thinking about how the feedback, which still needs to be contained and confidential to a certain extent, but the main themes that come up from these groups are embedded into real cultural change within organizations. So for me, it's really important that these things like this are funded, that there is constant dialogue happening between the facilitators, with the participants, and also leadership, and also tangible change, seeing how this is actually informing policy change or actually informing cultural change within the organization, which will also then help support staff to attend and engage because they're feeling like their voices are being heard. So yeah, that's some of the main themes that I think are quite important from the work that I've seen and also what I'm hoping will be continued by Adopt London.
Thank you. There were some really helpful insights there, and certainly just understanding. I think you've made a very strong case for kind of why it's important, I suppose, to have a Black therapist in that space. And I know you've kind of made reference to things like the Employee Assistance Programme. And of course, this is a standalone piece of a pilot project, but it does fit in with wider organisational structures that we have that do exist as well. And there may be other things going on in your organisation already that you can have access to outside of this. So it's just a little shout out there for people to make sure they're looking in their wider organisation as to what's there and what's available. Thank you. So my last question is for you again, Azra. Sorry to put you back on the spot. And you've spoken to some of this already, really. So, the findings really highlighted really strong support from the Adopt London heads of service, but there were barriers to attendance as experienced in the actual evaluation findings. So, I know you spoke about some of that, things like the scheduling conflicts and the privacy and things. So do you think there are any views that you might have really that or insights, any additional insights that you want to add to some of those barriers? So it's something that we can think about, and anybody thinking about doing safer spaces could think about as well and take away that you may not have already mentioned.
Of course, thanks so much, Audrey. And I have to also thank Yaa for just setting up that stage about follow-up. I think that's a crucial one that did come about from the evaluation findings, and also great to hear Chloe's experience as well. Very much aligns with what we have heard during the evaluation as well. But yes, really want to begin with the fact that there is certainly a very strong support from the Adopt London leadership for the Safer Spaces initiative, and I think that's incredibly promising to see this sort of initiative and intention to continue this in the long run as well. But again, staff participation, like I had mentioned previously, was certainly hindered by several key barriers. Largely, these are logistical, but some are tied to the broader workplace culture and priorities as well. And I think these are important to again reiterate to ensure that there's a follow-up around that in the future as well. And these can help inform the next iteration of the Safer Spaces session initiative as well. But yes, primarily scheduling conflicts, of course. Many staff, like I had initially mentioned, did find it difficult to attend sessions due to work commitments or conflict in priorities. And it was often the case that the reality of high caseloads meant that the staff had to often choose between attending a Safer Spaces session versus competing or completing pressing work that was on their priority list as well. Even when sessions were recognized as beneficial, and they very much are, of course, across the organization, there was often this sort of unseen pressure to manage workloads. So this was certainly a key factor or key finding that served as a barrier for some of the participants. And then, of course, because these sessions are virtual, presence of private spaces is very crucial, especially if you're working from the office, for example. Since sessions were conducted online, some staff very visibly did struggle with finding the right places and spaces so that they could speak freely. Again, this seems a very sort of not that important of a barrier, but could maybe help inform what modality the Safer Spaces sessions can take in the future, given also the fact that people did express a preference for in-person meetings as well, or a hybrid approach to allow for deeper discussions as well. Online format reportedly, of course, did increase accessibility for some, but others found it more or less less conducive to meaningful engagement, which I believe an in-person session can certainly provide more of. And then, of course, the competing priorities part as well that I mentioned, where these sessions were often seen as an extra task instead of like a core part of their, let's say, professional development or mental health, for example, strategies. So this is certainly something that could be considered for the future. That said, again, a big qualifier here is that we also, in our evaluation, did see the fact that the Adopt London leadership was very highly supportive of the initiative, but also recognized this component about attendance and in line with generally the value of these sessions. So it was acknowledged by the leadership that the low attendance, of course, from their own observation as well, remained an ongoing issue, and felt that around this, clearer communication can certainly be done, and that internal prioritization could potentially also help address this. So this could be again in the format of like making sure that attending these sessions should or can be seen as a workplace priority rather than an optional activity or an afterthought. Um, Except in, of course, in the cases of emergency workload or caseload that might come up, participation should be formally recognized as part of staff development, which is again the core aspect of the safer spaces sessions. And again, I think it all comes down to how these are communicated about as well. So heads of service very much and in a very promising manner certainly indicated throughout this evaluation that internal communication needs to be in such a way that it reinforces the purpose and value of these sessions. Some staff may still be unclear about what the initiative is meant to achieve in the long run. So just that proper communication could help ensure that the sessions are understood as a legitimate part of their professional experience, not just an extra task that they need to undertake. As a conclusion, I know that I'm talking probably way too much here, but as a conclusion, for the initiative to reach its full potential, clear communication, stronger messaging from the leadership, and generally like tangible solutions to logistical challenges that have been identified can certainly be critical in the success of the next iteration of the safer spaces. I will end there. Thank you.
Thank you. Thank you very much, Azra. And I think really good food for thought, like I say, for us to take away. And certainly we'll be looking at that when we review the evaluation findings and just think about the changes, because I think what we've seen throughout the process is that we've seen growth and changes at the end of each phase of the safer space sessions. We've actually seen growth, and I think that onward trajectory, it bodes well in terms of us understanding. But actually, I think that the quality of actually bringing people in to co-create and think about, how can we collectively think about making this work, and bringing everybody in as part of the solution, because I think that's imperative. And I think there's lots of being done unto, as we say, and actually, no, let's empower and equip and empower people to think about how they can make a safer space that works for them. So I'm conscious we've got a few short minutes left, and we've got a couple of questions that have popped up in the chat. The first one: how do we mitigate the impact of lack of cultural competence in a majority white workforce? So that's one question that's come up, and I think I might try and see what I can do to answer that question. I don't think that I have the solution, or it's in with me, but I think we can open it out to the panel as well to kind of add anything. So I think it's the cultural competence certainly is something that I know that Adopt London have been addressing it since we've been on this journey, pretty much since the start. So we've tried to make sure that people are feeling a lot safer about talking about what they don't know, what they don't understand. We're opening up discussion so that actually we can grow together as a workforce, and it's not the responsibility of a single group of people to kind of battle this particular challenge. There's a saying, you don't know what you don't know, and we've got to appreciate and respect that. And if people don't know, that people have got a duty to educate themselves, and part of that education might be around just showing some curious questions, some respectful curious questions, and having a better understanding of what's going on. So I know we've in our earlier days we've certainly had some training from Laurel Brown Training and Consultancy as well. We've had speakers come in and speak about some of their experiences as well, people with lived experience, just to try and open up those conversations. And I can certainly attest to that, initiating conversations within my own organisation. I'm not saying we're there, we're still on a journey, but actually I think people have felt safer to say, I'm not sure. Am I using the right terminology? Have I approached this in the right way? And I think in that space, we've got some really solid organisational learning. So I don't know if anybody else wants to add to anything else there from the panel. No, Thank you. I'm going to try and get through as many questions as we can because we've got a very short time left. Now, a question again, how do we demonstrate that the multiple issues impacting Black adopters are systemic and not about singling out individuals or LAs who have not or are not getting it right for Black adopters, but rather a recognition that our services for Black adopters needs more focus and less blame? So I think that's about not singling out individuals in terms of the process, but looking at the systems. That's how I'm reading that question. Do any of the panelists wish to think about a response for that?
Yeah, I'm happy to share a little bit if that's helpful.
Please do.
I guess I'm thinking more around when we think about how do staff of the same ethnicity advocate and challenge when injustice or disproportionality is identified. I think it leads back to also thinking about safety. A lot of institutions don't feel safe for people of colour, so therefore, or people from the global majority, so therefore people don't want to speak out or advocate for fear of being reprimanded themselves. And I think when we are thinking about change and we are thinking about really being advocates of change, there is something about taking risk, making sure that you are supported. So you are in spaces like this and safer spaces where you can access support, joining unions, but also making sure that you do speak up and making sure that you do advocate, making sure that you do have ensuring that there are ways, that there are trails of conversations that you've had, which is really important. But I feel like there are a lot of minoritized staff or people from the global majority that are aware of the racism, that they're identifying it in their own experiences, but don't feel empowered enough or supported to vocalize. And it's essential. It's sad that we have to be the advocates of change for our own experiences. But what's even sadder is witnessing these things and being complicit in the silence. So making sure that you are resourced and supported enough to advocate for somebody and also to advocate for yourself is kind of essential. Because then when we're not doing that, we're internalizing the microaggressions that we might be seeing, and that kind of compounds a sense of imposter. It compounds our own silence. So that's one element that I think is quite important to be thinking about, because when we are silent, we're essentially being complicit in white supremacy and reenacting that within our own dynamics, our own relational dynamics with our peers. So yeah, I think that's quite important to reflect on as one key area.
Thank you very much, Yaa. And I'm not sure we've got time to get to any other questions because I'm really conscious that we've got 2 minutes left. So it's just I'll use this moment just to take any last reflections from the panel. And if there are any other questions that do come up, as I say, we'll try to attend to them. But and just the last plea for everybody, say thank you so much for being a part of this. And do sign up to our Black Adoption Project through the QR code if you can, because you'll hear more about what's going on. You'll be kept abreast of the changes. You'll know when webinars like this are coming up, and also you can share that across your networks as well. That'd be really helpful. So I'll just see if my panelists have anything else they wish to say as a final word.
I will.
Yes, Chloe.
I would just say, just encourage your colleagues to attend, any Black staff to attend the safe space sessions. Just say one session, see if you like it or not. I would just encourage them to do that because it's just all feeding into like the bigger picture, basically, and it's good for themselves as well as the organization.
Amazing. Thank you. So just to thank my guests. Thank you, Chloe. Really appreciate that. Thank you, Azra. And thank you very much, Yaa. I think you've added so much value to this. And thank you all for attending the Safer Space webinar as well. I hope you've been able to take something out of this and think about how you can take that into your own spaces and make some improvements. We really appreciate it. Thank you very much.